President Barack Obama is appointing an Ebola czar to deal with the growing crisis. Former White House advisor Ron Klain will coordinate the U.S. efforts to combat the deadly disease, the virus. Republicans were asking for an Ebola czar, but some say that Ron Klain, who used to work for Vice President Biden, does not have any public health experience.
What we were looking for is not an Ebola expert, but rather an implementation expert.
Nina Pham, the nurse who came down with the virus after treating Thomas Eric Duncan, is resting comfortably at the National Institutes of Health. The second nurse to contract Ebola is getting treatment at Emory University Hospital. Officials are trying to pinpoint when Amber Vinson first started showing symptoms, before, during, or after she took a plane from Ohio to Texas. And a lab supervisor who handled a specimen from Duncan is quarantined on a cruise ship. She has shown no signs of infection, but is confined to her cabin until the ship docks in Texas.
With Minnesota home to the largest Liberian population outside of West Africa, there's growing concern that the deadly virus could travel here. That's why Governor Mark Dayton called together a panel of health, public safety, and government leaders today to update Minnesota's plans and its state of preparedness. Bill Hudson joins us now with more on what's being done and the work that lies ahead as well, huh, Bill?
Yeah, a big concern here, Frank. Health leaders made it clear today they're digging in for a very long fight. That's because concerns over how to treat the Ebola threat will be here until the outbreak in West Africa is finally over. As the world watches the growing Ebola death toll in Africa and a slow, terrifying creep in Texas, Minnesota leaders are preparing for the worst. Today, Governor Dayton called together his Ebola prevention and response team to get an update on our readiness.
We've learned a lot. The situation in Texas has taught us a lot. We've understood that it's really the healthcare workers that are at the greatest risk.
Already, MSP Airport is identifying and testing passengers who exhibit any signs of illness.
Those people are pulled aside, they're evaluated, their temperatures are taken. That is taking place today when we see a particular purpose or a need for that to be executed or done.
And the health department is working with all hospitals to identify potential patients who would then be transported to more specialized centers around the state, more capable of treating and containing any further outbreak, so-called centers of excellence.
We've set up a incident command structure, and we've linked that with the hospitals throughout the community.
The virus is physically not here, but mentally it is.
Public meetings with Liberian Americans aim to inform and prevent stigmatizing. But Senator Amy Klobuchar says protecting Minnesotans will ultimately depend on the fight in Africa.
In addition to the work we have to do to protect Minnesotans and protect the people in this country, we have to remember that the best way to do this is to stop it at its source and reduce it in Africa.
And Senator Klobuchar says that's why Congress approved $750 million for U.S. troops to help in the fight in West Africa. We also should point out that nobody in the state is currently being isolated or quarantined for any suspected Ebola symptoms. Frank?
Yeah, good to point out, Bill. The nurses union was certainly concerned earlier this week. They're worried about do they have enough training? Do they have enough equipment? Was that addressed?
It certainly was. And matter of fact, tomorrow, Governor Dayton is going to meet privately at his residence with nurses from the Minnesota Nurses Association, as well as doctors, hospital administrators, and first responders. He wants to find out firsthand what each group needs to be fully prepared or trained if or when that first Minnesota patient arises. Let's hope not.
Yeah, let's hope not for sure. Bill, thank you.